Okay, we're gonna start meeting now and everyone else can join as we're going through announcements.
So, hi everyone. Thank you for coming to our week 1 charting and anatomy presentation. I know everyone is going through some really tough and stressful times with online classes and the COVID outbreak. So despite this, we will still try to get through this together as the pre-dental society. So we will try to continue doing informative video meetings to keep our members updated on dentistry stuff. So a couple of announcements. We won't be having any more in-person meetings or events such as the philanthropy events, fundraisers, socials, or banquets for the year because we are future health professionals and we must adhere to strict social distancing protocols as such. Next slide.
Okay, so can everybody hear me? Yeah, okay.
Yep.
So even though our hygiene kits, we meant to do it through spring and do a raffle and everything, but we still have to do our raffle for the winter collection. So we're gonna do this remote style. So I still have everybody who donated, so thank you for donating. And okay, I'm just gonna do it. I even have an impartial person here to draw it for me. Okay, so the winner is Cindy. Oh, yay.
Yay.
Congrats. I will contact you after the meeting and let you know more about your prize and everything. But thank you for donating. And thank you to everyone who donated. I stopped video.
So we're going to start with our charting and anatomy presentation.
All right. Hi guys, my name's Kobe, and me, Sarah, and Cindy are going to be over charting and tooth anatomy. So the use of tooth anatomy is that it's very for dental. Your shadow dentist and they're asking you to help out and volunteer. They're going to ask, and so very important to know what charting and where the teeth, all well as have a basic understanding of teeth is just really beneficial for in dental school. And so I just like us to just take a minute and just look at this picture and see where the stains are. You can see there's around 6 stains, and just try to keep a mental image of that. All right, okay. And so, which teeth has a stain? With understanding of how tooth anatomy is, you'd be able to clearly communicate to any professional or just anyone in general with the vocabulary and a universal way to just understand, having to reference a picture or with you at the time. And so we're going to start off with orientation. The starting point of we'll start would be your upper right side, and then you go to your upper left, and then you move down to your lower left to your lower right. And this is relative to the patient. So if everyone goes and touch their right side of their mouth on the upper side, your first molar right there on the farthest right side would be number 1, and then you just start counting down 2, 3, 4, 5, 6, 7, 8 till you go all the way to 16 on your upper left, and then you go around. And for an adult, we have 8 teeth per quadrant. On the right, upper right, 8 on the upper left, 8 on the bottom right, and 8 on the bottom. And the counting orientation follows with 1 through 8. Since we start from the upper right, 1 through 8 on the upper right. Sorry, I can't even. 9 to 16 on our upper left, 17 to 24 on our bottom left, and then 24 to 32 on our bottom right. And for baby teeth, it's different. They don't have as a big jaw, so they only start off with 5 teeth when they're born, and it's or teeth per quadrant when they're, and we just use the letterings A through T.
Okay, so we're gonna go over the anterior and posterior teeth now. And for anterior teeth, these are the teeth that are in the front, and posterior are the teeth that are in the back. So the anterior teeth consists of your 4 central incisors. So there's 2 on the top and 2 at the bottom, and these are the ones that are very front and center. And then behind those are your lateral incisors, and once again, there's 2 on the top and 2 on the bottom. And then there's your 4 canines, and these are the pointy ones, 2 on the top and 2 on the bottom again. And for anterior teeth, it's for biting rather than chewing, and it's important for speech. And then moving on to the posterior teeth, these consist of your premolars and your molars. And what distinguishes the molars from the premolars is that premolars have 2 or more cusps, and they're tailored more towards chewing. So for premolars, there's your first 4 premolars, and then it's followed by the 4 secondary premolars. So if you look at the picture, the one in the front are the first premolars, and there's 2 on the top and 2 on the bottom, and then they're followed by the secondary premolars. And these are used for holding and crushing food. And then onto the molars. These are the teeth that are behind the premolars. And similarly to the premolars, there's the first molars and the second molars. And then, but what makes it different is that there's also third molars, and these are also more commonly known as your wisdom teeth. And like I said earlier, these are posterior to the premolars, and they're used for grinding food. So now we're gonna go on to the surfaces of your teeth, and we're gonna start off with the mesial and distal surfaces. And so some important vocabulary that you need to know is the midline, and this is the division down the center of the teeth. So if you look at the picture, that's that black line that goes right down the center of that mouth. And mesial and distal surfaces refer to the surfaces that are in between your teeth. So for the mesial surface, that's the side that's closer to the midline. So in the picture, that's the blue highlighted parts of those teeth. And as you can see, they're closer to that black line. And then there's the distal surfaces, which is the side that's away from the midline. And that's the purple highlighted part of the teeth. And they're away, as opposed to how the blue highlights are closer to the midline.
Some other surfaces of your teeth are called the facial and lingual surfaces. The facial surface are the sides of the teeth that are closer to the lips and the cheeks. The side that is closer to the lips are called labial, and the side that's closer to the cheeks are called buccal, and those will be in the posterior, and the labial are on anterior teeth. Some other surfaces that are used for biting are called incisal and occlusal. As you can see in the picture, incisal are the teeth on the anterior, are the surfaces on the anterior teeth, and they're highlighted in blue, and occlusal are the surfaces of the teeth that are highlighted in purple on your posterior teeth. Now we're gonna go over charting. When you're charting, it's important to use color coding. The black symbols are used to represent current dental work that exists. The blue symbols represent dental work already completed, and red symbols are used to indicate treatment to be completed at future dental appointments. For example, this is what a charting symbol would look like. A tooth that will be extracted is shown as a red slash, and a missing tooth is shown as a black cross. And you can look and see there's other types of symbols that are used to indicate certain treatments to different teeth. Thank you for coming to our meeting and watching our presentation. We've included some contact info below, and we'll start a Kahoot to go over what we just learned.
So now we're going to be transitioning to our Kahoot game. So if you can please open up another browser or pull up your phone. And let's get started. Is this everyone?
There's 21 people.
Okay, we'll give it some more time. I'll give you another 30 seconds. Okay, so last 5 seconds, and let's start. Okay, everyone seems to be doing pretty good. And our leaderboard, Harry, nice, first place. Second question, what surfaces do you clean when you floss?
Remember that when you floss your teeth, you're flossing in between. So those would be your mesial and your distal. The occlusal and scissors are the surfaces for biting.
Oh, sorry, went a bit too fast. Let's do the leaderboard on question 3. So this is our leaderboard. Harry is still in first place, followed by
Kobe, you're muted.
Kobe, you're muted.
Oh, sorry. Could you not hear me? Sorry. I just said that we always start on our upper right to, and then we moved our way down to our bottom right, where you start off from your upper right and make a half circle. So that's why it's true. So pretty much the only things that aren't anterior teeth are the molars, so and premolars. So just understanding that everything else with the incisors and the canines are anterior teeth. Yes. So this one's a tricky one. The blues are the ones that are already completed. Black signals things that are in progress and being worked on, and then the red is the for the color procedures are going to be worked up in the future.
Yeah, so there's 8 teeth in each quadrant because there's 4 quadrants and 4 times 8 makes 32, and there's 32 teeth altogether. Yes. So for this one, there were 2 right answers, and anterior was right because those are the teeth in the front, and central incisors were right because those are the 2 teeth that are the front and center. This one is false because to signify an extraction, it's a slash instead of an X, because an X signifies that there's a missing tooth. And it's also supposed to be in red because that means to be completed, and black means current existing dental work.
So labial is the correct answer for this question because as you can see, the teeth are the closest to the lips, and that's how you can remember it's labial. Anterior teeth are used for biting rather than chewing, so this is false. Anterior teeth are your teeth in the front of your mouth, so that's what you use when you bite into like a sandwich. Again, the correct answer is anterior because the teeth that are in the front of your mouth are used for speaking and pronouncing words. If you remember in the presentation, there's a picture of the mouth with a black line in the middle, and that's the midline. The correct answer should actually be mesial because mesial is a surface that's closer to the midline and distal is a surface that's distant from the midline. So that's a trick you can use to remember that distal is a surface farther from the midline and mesial is a surface closer to the midline.
Yeah, this is wrong. Everyone that put mesial is correct. Who said no?
Yay, good job. Who is Cody? Is that Cody?
No,
Kobe?
I was Kober.
Who is it?
That's
Me.
Caroline.
Yeah, Caroline.
Caroline. Ah, good job, Caroline. Thank you everyone for playing. I hope you found this interactive. And we will be posting this presentation as well. So if you want to rewatch it, you totally can. And thank you everyone again for coming out. It was great seeing everyone.